Hey, this is Dr. Barrett. Thanks for joining us on the Real Health Podcast. My passion is to help equip you with information that can change your life, the health of your life, and the health of your families. I'm a board-certified chiropractic physician with a passion and emphasis in nutrition and sleep and how to biohack the body to get to a greater level of health. Thanks for listening in to the Real Health Podcast. Welcome to another episode of the Real Health Podcast. This is Dr. Barrett, and we're going to dive into COVID-19 vaccines, and we're going to touch base on pregnancy and vaccines as well. So that's the kind of the topic for today. Now that we have some evidence and some research since COVID has come out, we're able to kind of assess the situation a little bit more and understand what we are seeing with COVID-19 vaccine reactions. And then always, because such a large population of our patients are pregnant, we're gonna touch base on pregnancy and vaccines as well. So, hey, I hope this hasn't been a super boring series. I know it's easy to get caught up in a lot of just kind of information and research and data. Sometimes that can be a little boring, but hopefully it's been valuable for you. You've enjoyed it, and so without further ado, let's dive in. So I hope you had a great Thanksgiving. We were living it up in the warm climate of Florida, so it was an awesome time for my family and I. And so as we get into COVID-19, what we're seeing is we're going to go through some of the, again, risks, odds ratio of the vaccinated group versus the unvaccinated group. So that's the majority of it. Now, we'll also touch base on the comparison of certain vaccines, like Moderna's versus Pfizer's versus China's CoronaVac. And so let's touch base on this one. This is something I see a lot in the office, but it's Bell's palsy. And so this was done by Sato and Wan in 2021, and they showed that the Moderna mRNA 1273 had a 1.54 increase in Bell's palsy against the unvaccinated group. Pfizer's was 1.84, and the CoronaVac was 2.38. Shibley also did some digging, and research showed that with females specifically between the ages of 45 to 64, there was a 1.71 increase risk. But with over the age of 64 was it was almost double at 2.51. And that's specifically with Bell's palsy, which is a type of facial paralysis. And it's interesting because I actually saw an uptick of that post-COVID. I was just kind of wondering why. And, once some evidence came out, it made sense. So the increased odds of hospitalization with Bell's palsy after Pfizer, the first dose is 1.54 times increased odds risk ratio, and the second dose was 2.33. Now, a lot of people have heard about the cardiovascular cardiac adverse events, and so let's shed some light on that because is it true? Is there an association? So Kim and Lai in 2022 showed that there was a 12.72 increase risk of hypertensive crisis, 7.94% for tachycardia, supraventricular tachycardia, SVTs. I was talking to a patient today about that, where she was developing tachycardia, or it's a very high heart rate symptoms, 7.94 times increase risk odds compared to the unvaccinated group. And we saw myocarditis. We saw after a single dose was 9.15 times greater risk odds. After the second dose, it jumped to 29.61 times increased risk compared to the unvaccinated group. That's massive, especially after that second dose. So cardiac events, adverse events are showing a correlation there for sure. Myocarditis specifically, there's another study done in males that was pulled and showed between the ages of 16 to 24, So 16 and 24 years of age with males following the second dose with Myrna, with the mRNA. Moderna was 13.83 times compared to Pfizer's only 5.31 times. And then in males between the ages of 16 to 19 years of age, we saw it about 2.35 times in the general study population compared to the unvaxxed. But then in the 16, 19-year-olds, we saw it right about 9 times higher, 8.96 times higher. So we saw that a lot with soccer players in Europe and basketball players dropping, and so myocarditis is definitely there's an associated risk following the mRNA and the Pfizer. When we look at COVID-19 vaccines and thrombosis or thrombocytopenia, so this is more based on embolic events, so strokes, blood clotting disorders. We saw with idiopathic thrombocytopenia purpura, we saw 5.77 times increased risk with an arterial thromboembolic events. We saw it 1.22 times higher. With hemorrhagic events, we saw it at 1.48 times increased risk. Thrombocytopenia was 4.29, and then cerebral venous thrombosis. So specifically, we're now looking at the brain clotting disorders, 12.04 times increased risk. So there's definitely a correlation there, guys, with COVID-19 and vaccines and associated risk increasing with myocarditis, thrombocytopenias, blood clots, and the list goes on. One of the things I also saw clinically is an increase in shingles, but there's some evidence to show this, not just anecdotally. So Pfizer, from the first 2 weeks, pretty much after the first dose, we saw a 5.23x increase risk for shingles, and then very similar to the second dose. So when they got the second dose, is 5.14 times increased risk odds. Pfizer's has also been associated with hearing loss at 1.35 times increased risk odds. And then one of the really kind of interesting ones that I saw was how they compared an increased risk of adverse events from COVID-19 versus the influenza vaccine. So they compared those two. And this was done by Montano in 2022. And they showed that COVID-19 versus the flu vaccine had a 42.53 increased risk odd of death, 45.71 for hospitalization, and 56.13 compared to influenza vaccine for life-threatening reactions. So pretty significant increased risk odds of those comparatively to the influenza vaccine. So that's a little bit of the latest on COVID-19 vaccines. And then in relationship to vaccines and pregnancy, as we switch gears here, what we're going to look at is the most important thing is that they've never been studied. So to hear, safe and effective for pregnancy, you got to remember there's no pregnancy clinical trials being done on vaccines. Potentially, if a pregnancy patient is in a vaccine trial and they didn't know they were pregnant, those cases have existed, but they're thrown out of the clinical trial. There's no specific clinical trial of research done on pregnancy and vaccines that just isn't being studied. But yet the common ones that are usually given during pregnancy is going to be flu, Tdap, and COVID-19. So we're just going to look at some evidence here of pregnancy and vaccines. So Zerbo in 2017 published in the JAMA, Journal of American Medical Association, in the Pediatric Journal, showed a hazard ratio of autistic spectrum disorder from influenza vaccine in pregnancy as being a 1.2 times increased risk. Irving in 2013, the odds ratio for spontaneous abortion following the flu vaccine. So they had a flu vaccine prior to conception versus the unvaccinated group, if that makes sense. They had a flu vaccine prior to conception, and then they compared the group that was unvaccinated. and showed the odds ratio increased risk for spontaneous abortion was 2.55 times higher in that group. Zerba also did another study and showed that there was a 11.4 times, this was done in 2013 by Goldman, 11.4 times increase relative risk for fetal loss for H1N1 versus the vaccine itself. So they compared fetal loss with getting pretty much H1N1, getting the flu, versus those that are being vaccinated, and showed 11.4 times increased risk odd of fetal loss in the vaccinated group compared to the group that actually had the flu. So that was an interesting study, kind of cool comparing the two. Not cool the results at all, but there you have it. Donahue in 2017. This was the odds ratio for miscarriage within 28 days of flu vaccine if vaccinated in consecutive years. So this is obviously more than 1 year. Consecutive flu vaccines increase risk for miscarriages within 28 days of the flu vaccine with prior vaccination status of flu. And it was 7.7 times higher than the unvaccinated group. And one thing that they noted in the study was they saw high levels of C-reactive protein, or CRP, HSCRP. CRP is an inflammatory marker suggesting systemic inflammation. Typically, it's going to be elevated with injuries, infections, and so they saw an increase of that in that group. So in Price in 2010 did odds of regressive autistic spectrum disorder from prenatal thimerosal. This was with 16 micrograms of thimerosal in the vaccine, and they showed a 1.86 times increased risk. De Silva in 2022, we're going to look at rate ratios of adverse events following COVID-19 vaccines versus unvaccinated group. And so fever was 2.85 times higher, malaise was 2.24 times higher, local reactions 1.89, lymphadenopathy was 2.16, postpartum hemorrhage was 9.5% versus 3.2% to the unvaccinated group, and the gestational diabetes increased from 8% to 12%. Pregnancy and vaccines continuation here, and this was done in 2022, and they showed spontaneous abortion increase was 3.2x. Fertility problems, and this is just a heads up, this is specific to COVID-19. Okay, so COVID-19, specifically vaccines. So 2022, spontaneous abortion, 3.28 times increased risk. Fertility problems was reported 3.4 times increased risk odds. Sperm concentrations in males reduced by 16%, and sperm motile counts reduced 22%. So we definitely are seeing not only an issue with vaccinations in there, the outcomes of health in the child and during pregnancy, but we also are seeing specifically COVID-19 vaccines and its increased risk with fertility outcomes, which obviously we already have a massive problem in our culture today with fertility outcomes, and so this doesn't help the situation. So to kind of summarize, a lot of that data is, all right, so we start to see some info pop up now with COVID-19 vaccines and their increased risk odds ratio of certain disorders. And then we see, obviously pregnancy is important to have a conversation with your medical provider about, hey, can you just give me evidence on the safety and the effectiveness of it? Again, I'm not here to, and this is very important for you to hear, I'm not here to communicate what you should do. Right? I'm not here to tell you, you should vaccinate, you should not vaccinate, you should vaccinate these, should not vaccinate these. That's not my role. That's not my job. Actually, if you even were a patient of mine, I don't sit you down and say, hey, don't do this, or I need you to do this. That's not my scope of practice. That's not my intention here. But what I am communicating is just data. what we're seeing in research. And so it's important to make informed decisions. Informed consent is so vital today. So you have to take in all the information about the environment you're living in and the environment you're raising children in, and research and data, and work with your your primary care physician, and have a conversation about what is right for you guys. So anyway, I hope that was helpful for you, and we'll continue the conversation here on vaccines for one more episode, and we'll wrap it up. And then, so we'll talk a little bit about, we're going to get into some herd immunity conversation, and then we'll talk about Tdap specifically. So that'll be the next episode. And then we'll have some fun getting into the new year. We'll dive into, I'm going to do a couple-part episode on cancer, and just some things that you can do to understand where cancer comes from, how it develops, and how you can be a fight against the inevitable process that all our bodies have, which is we develop cancer cells on a daily basis. How does our immune system handle that? How does it clean it up? How do we step into states of autophagy where we really heal? And so that'll be coming down the pipe here soon. It is Thanksgiving season, just finished up. Now we're stepping into Christmas, and I just pray a blessing over you and your family. I pray that this season is a season where you feel refreshed and not burdened, that you feel blessed, that we can truly get a vision for what this season is really all about. Man, it's amazing to be in the country that we live in, but gosh, it is hyper distracting on just some core principles. And we live in this culture of just so much marketing and purchasing and buying. It's easy to get kind of lost in that. So, I pray it's a good season for you. So, hey, if you're thinking about making a health change in January, let's start now. Let's start now. There's no reason to wait till January 1st. And so we're here to help. Let us know. Contact us if there's anything we can do for you. But thanks for listening in to another episode of the Real Health Podcast.
Thanks so much for listening to the Real Health Podcast with Dr. B. Before you get out of here, before you exit, there are two things that would really help the Real Health Podcast. One would be to share it on your social media, your Facebook, your Instagram, wherever you're on a social network. And then two, go to Apple Podcasts and scroll to the bottom and give us a 5-star review and leave us a review. Thank you so much again, and we'll see you next time.